So in this second video that we're doing today, we'll probably start with when a woman comes of age. What do you see in young girls, particularly when they have their first period? What happens around that time?
So you mean menarche?
Yeah.
That is when they start the first period. So interestingly, there's a lot of talk now about period, which used to be a very taboo issue. I think when I was a teenager, we were not discussing it so openly. But now, thanks to a lot of television, a lot of movies also, people have started talking, and girls also started coming out about problems that they have during menarche. Usually menarche starts a little earlier these days, like even as early as 11 years, and even 10-year-olds also start their first period. And it's a series of events basically. So grandmoms and moms make out when the girl starts increasing in height, then there is breast development, underarm hair starts, there's weight gain, and then finally they start the period.
Would the girls know when they get it? Because we hear as boys, we don't hear much about what happens to a girl, and sometimes the girls may be off school a couple of days, or sometimes more or less. So would the girls know in advance that they could be having this, or what should somebody look out for, being a parent or being a school teacher?
So there are a lot of menstrual hygiene awareness campaigns also going on nowadays. Many schools have the sanitary napkin dispensers also available in the washroom, so that in case someone starts their period in school, they're not embarrassed about it. And things are changing now, perspectives are changing. So usually the series of events are, there's an increase in height, there is development of breast, there is development of hair in the underarms and in the pubic area, and at the end of it only the period starts. So there's a need for conversations even at home, where mothers, fathers, parents as such should be able to talk to their girl child and just keep them sensitized, so that they're not taken in a shock, what has happened.
And do they actually come to see you as a gynecologist when they get their first period?
I see girls with their moms mostly when there is a problem, which could be two types. Either the period is not regular, that means once in 28 or 30 days. So it is happening once in 2 or 3 months and they get worried. Or when it is very heavy bleeding, like if they are bleeding for say 7 days or 10 days, sometimes even a month, the girl is. So my advice is not to wait for so long. So even when you ask, even I do a lot of health talks, even in corporate companies, older women, many of the women are themselves not aware of the normal menstrual cycle, which I want to spell out, that between 22 days to 35 days, so 28 days plus minus 7 days, and 3 to 5 days or 2 to 5 days is quite normal. So anything which is more than 5 days, or they are changing a lot of napkins, they're getting anemic, tired, you have to take time off work, pain is so bad that they can't, then please go meet a gynecologist. Don't wait till it's too late.
Sure, yeah, because you mentioned a few things, because for a lay person, and for someone who doesn't deal with the physical side, at the bloody side, if you want to call it, you're losing blood, which means you need to be nutritionally superior.
Exactly.
And as you said, cramps, did you mention cramps, pain, which may affect your sleep, I guess? And that will all make you cranky.
Yeah. So then there are, time off school or time off college if they are going into. And there are a lot of, like you asked me how things have changed in gynecology. So polycystic ovary is a problem we see so much. There's another problem called endometriosis. I really want to spell it out again. Sure. Endometriosis, where there's a little bit of bleeding happening inside the body also.
So even in young girls?
Even in young girls. I've seen 16, 17-year-olds having this problem of endometriosis.
And how would they know that they may have this condition?
They probably never know, because any pain, they just take some painkiller, hot water bottle or things like that. And when you tell them do an ultrasound, when the pain doesn't go away with an ordinary painkiller, many educated parents also, shy away from doing an investigation like an ultrasound, fearing that there'll be some problem. So,
But I guess, again, we're now focusing on teens, and if there's an acute pain, I guess they take the child to a surgeon, mostly. Pediatric surgeon. But when it's a chronic pain, a niggling pain, because usually the girls tell their moms, I suppose, and they would say, look, we used to have this, my grandmothers used to have the pain.
No, I remember, like there used to be tablets like Beralgan, or you have a hot water bottle and just you bear with it.
Exactly.
So I would,
but then, what I see, even this again, adolescents, they're not able to put up with it, because, I know a lot of girls who do sport, they're very creative, they're in drama, dance, and do other things, And sometimes this chronic pain is niggling, and you don't want to be exposing them to high doses of painkillers. Our moms and grandmoms used to just pop a few pills and just carry on with their household chores or work. But I'm thinking there must be some alternative. This is where I think it was quite interesting that I was hearing about the value of sort of meditation, yoga, tai chi. Many of those activities where you can make your body more flexible, improve your blood circulation. Eating healthy and nutrition again is a hugely important aspect.
You're absolutely right.
And sleeping on time, gadgets. That's a huge problem parents complain of, right? Teenagers taking their gadgets to bed. That's happening a lot. I'm not against it. I don't want to be policing that to a great deal, but I think our teenagers are.
So how are things different in UK where you practice?
I think.
I'm sure you must be getting parents,
everywhere things are relatively the same in an internet age. I guess, looking at India, and again, more about India, we may have a more extended family support where the girls can turn to their grandparents for support, I guess, but there we don't have that. And we have a relatively well-developed school system and, information sessions for children, but still it's a huge problem. As I said, nutrition, looking at sleep, keeping them healthy during that phase.
Especially when we are moving, towards a lot of processed food and we are not taking a lot of natural food. And, when I tell people eat 5 fruits a day, they just look at me as if, it's impossible, whereas it is not.
And again, this is what we talk about, something that happens to a girl. But then when you look at teenage behavior itself, girls and boys can be a handful for parents to deal with. On top of that, if you have the hormonal changes and sleep issues associated with the menstrual cycle, then it becomes more problematic. And so do you get to see young children, being brought by their parents because they're not behaving well, they are snappy, they don't listen to instructions?
Yeah, I mean, we can't always just say it's hormones, sometimes you have to, and I guess even parents and even kids spend a lot of time in school. So how much are we listening to them? Are we actually listening to them? I mean, that's, I guess, even your area of interest where we kind of, we can't separate the body with the mind. So if there is a physical issue, like you have people, young girls taking time off school or college saying they have pain and they have, chronic pelvic pain, we call that. But sometimes there is a psychological, it could be attention-seeking behavior also. So how do you also
the way I look at it is, this is a real issue for the kids. Yeah. So I wouldn't always classify that as attention seeking. Of course, everyone likes attention. Who doesn't? Yeah. Children obviously, I would say, should demand attention. That's fine. Yeah. But I think one thing we need to recognize a bit more is the development of the teen brain. So by design, the frontal lobe of the brain, the prefrontal cortex, we call it, the front part of the brain, which is responsible for executive functioning. What I mean by that is making decisions, thinking about certain consequences of your decisions, how adults are supposed to behave. Not many adults even behave that way. That's not very well developed. So the teen is going through a development phase, and their amygdala, the center part of the brain, the midbrain, is more developed,
which is more emotional.
It is more emotional. So it is more reactive. Also. Exactly. So it's very emotional. It's very erratic, and the child is trying to become an adult, which means they're trying to make their own.
And there's a lot of pressure also.
Exactly.
You have peer pressure.
Peer pressure, and the world is changing very fast.
School pressure also nowadays.
Parents may not always understand the children's world. Things are changing very fast. They want to step up to being an adult and take responsibility, but sadly, they don't have the equipment. And it's unfair. I think it's unfair for the adult world to criticize children for being challenging, because sometimes they do forget that they have been teenagers themselves.
Sometimes we don't, with this digital age, right? Like, I wouldn't say, even I am perfect that way. Sometimes parents, grandparents, everyone is busy in their own little world of that mobile phone, and we're not listening to our teenagers, So how important is it to listen to a teenager? Because being a mom of 2 teenagers, sometimes I myself, either don't have time to listen to them, or I just, I lose attention. So how do you?
But it's important, isn't it? For anyone, the basic need is to be listened. So of course, the teenagers do expect that a lot. I think what I need to really emphasize is they're going through a lot. So I think the school system and the parents will have to be aware of that and acknowledge that. And just acknowledging that will get them on your side. So that is the most important thing, and they're really going through
And they're
things.
really smart, I think.
They're very
they need
smart.
to listen. They have really, they have a lot of information
So
at hand. And
you don't really think about that as a disease.
like even parenting, is it changing from a very paternalistic attitude where we used to sometimes listen that I'm right, the parent is right, and you have to do things this way, that way. These days, children come up with a lot of interesting ideas.
So there are conditions where teenagers do present with massive challenging issues. They need to be addressed.
So is the generation gap always going to be there? Or?
It can. I don't know, because do the children have to catch up with the parents, or do the parents have to catch up with the children? Difficult to answer. But what I think by this conversation I want to spread is really give the teenagers their due. They are going through some real difficulties with their brain developing in a certain stage.
And there's a lot of information they're flooded with, isn't it?
Exactly. The hormones.
When I was 13, I guess, you had a very simple
Absolutely.
life, and, now they're bombarded with a lot of stuff. So I get a lot of questions.
Absolutely. So now we can see we've spent a lot of time discussing about it. So hopefully this will start a conversation in homes around dinner tables with their teenagers. And the teenagers can then kind of contribute to the conversation and benefit from it.
Like family time, the importance. So just at 5-10 minutes, like I get couples also, just early pregnancy, and then the husband is complaining or something. I said, yeah, do you spend good time together? The husband says, yeah, I take her for a movie. I said, going for a movie is not spending time together. You're again looking at something else. Just sit across the table and have a conversation.
So now the teenager is ready to leave home. So we'll then go to the next phase of their lives when they have joined a university or moving to a new town,
then how things are
and then see
changing.
what happens. Yeah. So let's see that in the next video.